All right. All right, everybody. Hey, Leslie from Balance Body Studio. Again, coming to you live today with a friend of mine that I recently met in my most current fascial stretch therapy certification, level 4 and sport. This is Laura. Yes, we're the original, part of the original group that has gotten certified in level 4, so which is really cool. So I'm here today because I wanted Laura to share. Now, those of you that have done stretching with me know how amazing stretch is. Some of you have followed me since I've had my level 1, all through now through level 4. So you've seen the progression and the results through that. Some of you have, just started with. But I wanted Laura to share her story because it's really, really important. And I think one of our missions and one of my missions is to get fascia stretch therapy more recognized and get it more out there so people know that this is an option for them. And I think the more the medical community recognizes it and, starts to promote us as well as an option for therapy for people, the better the world's going to be because we've been gifted this amazing therapy and being able to share it with everybody. So Laura, do you want to share your story? Just tell us kind of your background, what you do, and then tell us that amazing connection that you have with the Mayo Clinic in Minnesota, where you're coming from.
Absolutely. Hi, Leslie. Hi, everybody. I'm Laura Flaherty, and I practice in just outside of St. Paul, Minnesota. I have been FST certified since 2012 and have gone through all my wonderful levels of teaching. FST has really been a foundation of my work. I'm a Pilates instructor as well. I do rehab Pilates primarily. I feel like the rehab Pilates and the FST really marry very well together. Um, I also come from a medical background. I have worked in orthopedics for 35 years as an assistant to orthopedic surgeons in the operating room, in the clinic. So I've had kind of a front row seat to see kind of a lot of these orthopedic issues. I started off in trauma medicine, so I saw all of it. I saw the worst of the worst. It was a great place for me to start. Now I'm in private practice and I work for a foot and ankle surgeon. So thank goodness I'm retiring from medicine in 2025. I hope to be done by May 1st. And then I can really shift my focus more into FST, which is really my love.
So I'm going to just
Um,
interject you here because I think
yeah,
a lot of my clients said, okay, so what was the new stuff that you learned? And there's a few different things, but one of the things that has impacted my practice the most is the foot. Like you just talked about, you worked with ankles and all that, the foot and lower leg stuff that we learned. Like just in the matter of a couple weeks, I've seen and I've worked with a few people, and the results have been insane. So, maybe you can speak on that a little bit because you are actually seen it open and live and seen probably actual fascia in, live. So what
yeah, absolutely. I also too, my clients have also experienced an enormous uptick in pain relief and enormous increase in mobility just by doing embedding the foot and ankle work that we were doing in our level 4 class, that lower leg work, that calf work. Leslie, it's really interesting. When I worked in trauma medicine, in order for us to put people back together, we just did what we had to do. And so there was just a lot of cutting through tissue and fascia. I'd have to say that a large percentage of the surgeons I worked with don't even acknowledge that fascia is its own separate organ or entity. They just think it's part of the skin.
Mhm.
So this is where it's really unusual. The surgeon that I've worked for the last 2 decades, he recognizes and acknowledges that fascia is its own entity.
Mhm.
And the first time I was in the operating room with him, he said to me, Laura, I'm just going to talk to you like I'm writing an operative report because I'm going to tell you everything I'm doing. And really, he said, I'm making a careful subcutaneous cut incision through the skin. But then his next sentence was, I am carefully dissecting the fascia out of the surgical field.
Mhm.
And as soon as he said that, Leslie, I thought, okay, wow, this is a big difference for me. And to work with a surgeon that acknowledges that fascia needs to be really separated from the surgical field because it really promotes better healing, not only just of the surgical site, but of, just of the skin itself.
Right.
And getting people to get their full sensation back, not having that incisional numbness or postoperative neuropathy, we call it the fancy name.
Yeah,
But yeah, I agree. The footwork has just been phenomenal. And now, of course, I look at my foot and ankle patients, and my FST mind is just going to another plane, another planet.
that's
It's,
awesome.
yeah,
That yeah, no, that's it's really been a game changer. And every level, it's like they just keep layering on new stuff. So it's really exciting. And Chris's final words, one of the final words he said before we left was, guys, there's always more to learn. So I'm actually looking forward to level 5. Let's apply what we've learned so far, but level 5 I think is going to be coming soon as well. So let's go to your client and that story that you told us about the Mayo Clinic, because I know a lot of
absolutely.
hearing kind of what happened with that.
So I shared this story with my level 4 class. And, I had a client who called me, and he had been a client of mine for a long time, and he kind of disappeared for a while. That happens. Clients do that. And he popped back up into my life and contacted me and said, I've had a myriad of health problems. I've had some cardiac problems. I've had some, fluid flow problems from my brain. I've had 3 or 4 different surgeries in the last 6, 7 months. And he said to me, I'm not driving anymore. That's really a big change. And he said, my back has gotten significantly worse since I stopped seeing you, mostly because of this sedentary practice I've had to do following surgery. But what he said to me was that when he saw the neurosurgeon for an evaluation of his spine, he was absolutely expecting for them to say, oh, yeah, we're going to do a round of cortisone injections.
Right.
The neurosurgeon at the Mayo Clinic in Rochester, Minnesota said, we are finding that cortisone injections are not ideal.
Mhm.
They're a band-aid. They're not doing what we want people to do. And with, your level of changes in your back, you're in a category where we really recommend something called FST. So the neurosurgeon says to my client, I really want you to explore this thing, and it's called fascial stretch therapy. The neurosurgeon also said it's important that you find the highest level practitioner you can,
Yeah.
because they're going to understand what they can and can't do with your back. There's certain moves that we know as practitioners that, depending on somebody's original status, that we can and can't do. But my client told me, he said, while he's meeting with the neurosurgeon, his eyes got really big.
Mhm.
And the neurosurgeon said, we have a FST person here in the Rochester area that you can go and see.
Yeah.
So my client said to the physician, well, I have stretch lady Laura,
Mhm.
and I'm going to get back to her as soon as possible.
Yeah. That is
So
that is amazing.
it is amazing. And when he's telling me the story on the phone, my jaw is on the ground. And I also too, it's like a dream. I'm hearing this to get the recognition. And I know it's not just a single individual physician at Mayo, it's across the border. One of the things too that was brought up in a conversation was that the Mayo Clinic really looks at, the Fascia Congress, and the fact that the Fascia Congress has been around as long as it has been,
Yeah.
and all of the scientific research that they produce year after year, it cannot be ignored that there is truth to this. So now things like the Mayo Clinic, there's another large medical group here in the Twin Cities called Alina, and
Mhm.
the Alina pain management doctors are also referring their mild to moderate stenosis back clients to FST versus doing injections.
That's
So there's other groups that are starting to kind of understand this and see this modality as being something that is not only beneficial for their clients, but very different than like traditional PT and they are calling us out, FST people, that we are at the tip of the spear of knowledge and scientific basis. They don't want to refer to other stretch modalities, groups, companies, franchises. It's just us.
yeah,
We're
because
the ones that are getting gifted this.
it's a different system, right? It's not your traditional stretching. We have the
No.
principle, like less is more, working in your comfort zone, in that R2 zone. We're not trying to cause or elicit any pain or discomfort. And I think
Yep.
that's the difference with what we do versus kind of other stretching modalities that are out there. Because I get all the time, I don't know about you, but I get clients going, oh, you can push further. You can go a little bit further, right? Because that's what they're used to. They're used to having to experience that pain. Uh,
Exactly.
that's not what we're trying to do. We're trying to calm the nervous system. We're trying to make it a safe environment for the tissues to want to open up for us, right? In the fascia.
Absolutely. And for us having that conversation with the fascia,
Mhm.
we're not forcing the fascia to do anything. We're not yelling and screaming. We're really conversing with it and having that, and I love the fact that Ann and Chris have taught us so religiously over time that, you only go in as far as the tissue allows you to.
Right. And that
And
can be different session to session too, right? Like,
absolutely.
and it depending what your client is coming in with, a stressor or an event that maybe happened that day, and that's what I kind of explain to clients. Like I have a game plan, right? Especially after that first session, I have a good game plan of, okay, what areas, what fascial lines do we need to work with here? But, that plan can change when
Oh,
the client walks in the door. And I think that's again what sets us apart. We're not so focused on sticking with the plan. And I think as you get higher in the levels, we learn that you don't have to jam as many stretches in a session as possible. It's more about listening, like you said, to the fascia and knowing what it wants and what it needs, and sometimes staying a little longer in certain positions or stretches that you maybe had planned for before. And I think again, that's what makes it such a different therapy is really being in tune with the body and the fascia.
absolutely. And I don't know, Leslie, if you've ever experienced this too, but I've had clients ask me, "Oh, do you do the same routine or the same stretches with every client?"
Mhm.
And I'm like, "Absolutely not." And
Yeah.
I said, I don't I don't always repeat the same thing with the same client. And I said, every day is different. Your body presents differently.
Mhm.
Exactly what you were saying. Who knows what people have gone through during the day? So it's just an opportunity to be like, okay, let's kind of focus in on this area.
Yeah.
Absolutely.
The cool part about this therapy too, it's obviously there's the physical benefits, increased range of motion, being able to squat better, run faster, all the things, but it's all the other little things that my
Mm,
clients have noticed, like sleeping better that night
mm,
or actually feeling themselves, down regulate the nervous system. I get a lot of yawns, a lot of deep breaths, in the middle, and that's a good sign. I tell them that's good. Like a lot of the times people say when they're done their stretch, they're like, oh, I wish I could just lay here for like 10, 15 minutes and have a nap, And that's
yeah.
good because life is so busy and life is so go, go, go. And people don't take the time to slow down. So first, many of my clients, this is actually 1 hour a week or 1 hour a month, however often they're coming, that they just feel like they're totally able to relax, which is for me, that's a bigger win than sometimes the physical benefits that people.
Yeah. I agree. And I want to quote one of our class members, Juan. I think he said, I think it was him, maybe it was B Train, but said, this is that time that when you're on the table where, you're just accepting this gift. You're just taking it all in. And it's the one time in somebody's day or week or month where they don't have to give anybody else to anything. They can just take this work in. And I mean, when that was said in class, I thought, wow, that is very powerful. And to think that, we are allowed to do that repeatedly for our clients.
Yeah.
And what a great thing. Yeah.
Cool.
Hmm.
So that's an awesome, like, again, thank you for sharing that story because I think it's, my goal and I hope in the future that this therapy does become more recognized and
Yes.
be more accessible to people. And it's only going to happen when people start talking about the results. And a big piece of it is, surgeons and doctors starting to refer because they're at the top of that medical chain. And then once they start to see the benefits and start referring, that's going to make a huge change as well. So this kind of leads into the next part. So you talked about the Fascia Congress, which is a huge thing, and we just have to shout out Anne because she's actually co-chair for the next one, right? She's been asked to be co-chair. So this is
Absolutely.
the mother of, fascia stretch therapy. She's the founder, the creator. I've talked about her a lot, obviously with my clients in my community. And, she's been asked to be chair or co-chair for this. So this is huge for fascia stretch therapy and Stretch to Win. So that's really cool. The second thing is she's actually in the middle or almost done. I think she said she was halfway done the double-blind study where they're showing that fascia stretch therapy can help with lower back pain. right? So
Right.
a little bit about that experience. So that is cool too. Once, Chris writes up that report and it starts getting published in medical journals, that's going to be huge as well.
Yeah, and another just kind of feather in the cap for Anne and for FST. And again, I mean, I'm sure that Anne and Chris would be kind of saying their mantra, stay humble, stay hungry, right? And for them, they would be like, I'm sure that they would believe that this was an opportunity for them, to grow and share and, do what they do best.
Mhm.
And for us practitioners, we see this as just another way that we're cemented as what we do is has validity, but also can be recognized across many other communities. I think in some ways Western medicine needs to do a little bit of catch up. And I'm only saying that from inside of the Western medicine world.
Right.
I'm kind of dropping my FST hat for a moment, but it is one of those things that, the more data, the more scientific research we have, the more that we can show what we know, us practitioners know, and our clients know, the better this is going to be. Yeah.
Absolutely. Absolutely. So thank you, Laura, for sharing that story. I've shared it with all my clients at one point or another since being back, but I know there's still people that are, follow me that have still not booked their appointments, but I know they're watching and they're interested and intrigued and like, I don't know if this is for me, but I think we talked about this yesterday where actually my favorite session is that first session with a client because I don't tell them anything, right? I don't tell them what to expect. All I say is, you know what, you're going to feel good after. It's a great stretch. Everybody needs to stretch. But, every single person that gets off the table has, a really good feeling and really good, things to say about the therapy in the session. And, getting comments like, where have you been? Or I wish I would have known about this sooner. All things like that. I feel taller. I feel lighter. Like those are the two big ones that I get. I feel lighter and I feel taller, right? And that's good because that's what our job is. I tell people our job is to what we're doing is increasing space in those joints so that everything moves freer. Your bones, your ligaments, your blood, your everything, right? Everything moves freer. So that's why you feel so much better and lighter. Right.
Yeah.
Yeah.
Yep, absolutely. Yeah. I also too, I'm with you, Leslie. I love that first session. And I love the surrender pose on the table, arms overhead or draped to the side,
Yeah.
legs splayed open, and usually a huge sigh from somebody. And it's usually a breath that they have not exhaled in a
Right.
long time. And it's just, again, Anne and Chris, thank you for the gift of this. It's just such a great and wonderful tool to have. I had a client the other day said, you're so good at this. And I said, you know what? I was taught really well. I'm just the vessel for it.
Yeah.
That's it. So again, Ann and Chris, mwah,
Yes.
thank you guys.
Thank you
Yeah.
so
And
much.
happy wedding anniversary, Ann and Chris, belated.
Yeah, and next year is the 25th sorry, the 25th anniversary of Stretch to Win as well next October. So I'm excited about that. And
Yep.
that's going to be a huge accomplishment for them as well. And I'm excited to hopefully be a part of it. I would love to go down and celebrate. We'll see if the stars align. I would love to be there and hopefully, a lot of our fellow level fours. And by that time, there's another class going on in March. So there should
Hmm.
be some other level fours, graduated as well. So that'll be really cool to connect with them. And because, I think, once you get to that level three, level four level, it's people that, are really engaged in this and really
Hmm.
see this as a passion and use it a lot in their practice, and a lot of us have other things we do as well. But for me, anyways, FST's kind of become the center of it, and then everything else kind of works around it. So it's like you said, it's been a great gift, and I'm so grateful. It's one of the things I'm always grateful for every day. I say thank you for the opportunity and I want to shout out Kevin Darby, who's the head of Stretch to Win Canada, because he's the one that brought it here to Canada. And I was actually at one of his, functional assessment courses, and he was the first one that demoed it in the class. And then as soon as I saw the difference in that 5-10 minute stretch he did on that person, I'm like, my clients need that. And it just grew from there. So
Yep.
Kevin as well, I haven't talked to him in years, but he needs a shout out too for bringing it up here to Canada, and seeing it grow here in Canada has been really cool as well.
Absolutely. Yep. Yep. And I think too, if some of us can't make it back to Chandler for the 25th, then I think maybe we need to have some local celebratory groupings, you
Absolutely.
know?
I'm even thinking, you know what, it would be cool to have different events, and we could host it at different people's clinics or places, and just whoever can come. And so like, people can experience. I would love to have three or four of you come here to Georgetown. It's this little small town, but have a stretch-a-thon. Let's have a
Right?
stretch-a-thon, right? Let's raise some money for a good cause or something like that. Like just something fun and, just again, like I just want to get it out there and
Yeah.
have people like see what it's all about and you know, everybody needs to stretch. And that's the thing. This is for everybody. I have clients from 12, 13-year-olds to my oldest is 95, right? So, athletes to the everyday person, injured people to just maintenance. It really is for everybody. And that's the cool part about this therapy. And it's
Yeah,
much,
absolutely.
yeah.
Yep. And the fact that we as practitioners can do this for a long, happy, healthy career, right? Yep, that we just don't, and like you said, like Chris said, we're always learning. And that is so invigorating as a practitioner. We're never just like, well, that's it. That's all we have. Nope, it's endless. Yep.
Yeah.
And with our wonderful collaborative
Yeah.
partners.
Exactly. My client's like, so when are you going to level 5? I'm
Yeah.
like, whatever. You know what? Maybe the net when we go to the level 4 refresher, they'll decide that we're the first level 5s. Right? Anyway, thanks again, Laura. I don't want to take too much of your time. It's a Sunday afternoon, so I really appreciate you
You bet.
doing this, and I'm sure we'll do some more stuff together and just keep sharing our wins and things that we're learning and, keeping the FST train going.
Absolutely. Yep. Thanks, you guys. Thanks for your time. Have a great day.
Thanks, everybody.
Bye, Leslie.